And welcome this 1st of February 2013 to another edition of the Health Research Report. Apologize once again for the poor lighting, but the batteries seem to be going a little dead in the LED light, I should say, or white light. So it doesn't look so dark. Alright, we got 3 articles today. First, soft tissue infections succumb to blue light, meaning infections are killed by blue light. 2, chronic hepatitis C. Interferon may kill you more than help you for reinfections or infections that don't respond to interferon to begin with. I guess if something doesn't work, we'll just give more of it and see what happens. 2, psilocybin. That basically found the milk thistle protects against UV-induced skin cancer. More than just protects against skin cancer, may be an incredible anti-aging supplement for the skin altogether. But now, let us begin. Number 1, skin, soft tissue infections succumb to blue light. There's a little nasty infection called Pseudomonas aeruginosa, which I may be pronouncing, but it's spelled A-E-R-U-G-I-N-O-S-A. And it's responsible for about $24 billion in hospital costs, actually probably not hospital costs to you, either through taxpayer incentives or directly from your pocketbook, in infections per year. I guess it's responsible for as much as 10% of all soft tissue infections. Well, this published in the antimicrobial agents and chemotherapy. In this study, listen to this. When they, of course, tortured these poor animals, but in this study, they infected animals with the Pseudomonas aeruginosa, and guess what? The difference was, out of the animals treated with this lethal skin infection that were given, actually, let's take it back, let's reverse it. The animals that were not treated with blue light only had an 18% survival rate, meaning close to 1 in 5 survived this lethal skin infection without the blue light. And we're just talking blue light. Nothing fancy. No antibiotics combined with it, no other antiviral agents, nothing weird, no alcohol, no iodine, just blue light. Guess what the survival rate against this deadly skin infection was, or this particular skin infection, soft tissue, skin, was for the animals when exposed to nothing more than blue light. 100%. All lived. 18% survival versus 100% survival. $24 billion in hospital costs due to these soft skin infections versus, I don't know, how much do you charge for blue light? You just screw it in? Wow. That would save $24 billion per year for just blue light? Think about that. So, when in doubt, if there's a skin infection and soft tissue skin infections, maybe something worth researching. Again, published in the antimicrobial agents and chemotherapy. I apologize, I only do this in one run. There's no retakes. But blue light, simple, powerful, extremely inexpensive. No one's going to be making any profit off it, but it's a lifesaver and something to keep in mind. Alright, after that, chronic hepatitis C infections. Chronic meaning it's not going away. So, they basically, everyone goes to the interferon route. It doesn't work. So they want to give you, or viral loads come back, and they want to give you interferon again. Think twice about that. Alright, an article published recently in the Cochrane Library. It says people with hepatitis C and chronic liver disease who relapsed or failed to respond to initial treatment are unlikely to improve on interferon retreatment. Hepatitis C affecting about 170 million people around the world. The authors decided to look at the studies in regards to interferon and hepatitis C reinfection. And they looked at several trials involving 1,976 patients with chronic hepatitis C liver disease who are being retreated with interferon monotherapy, having previously been treated unsuccessfully. Again, doesn't work. We'll just keep on doing it because it's the only tool we got. You think, but you may want to rethink that. When they included all the trials and analysis, the risk of death was no higher for interferon than for the placebo or no treatment. And of course, when you look at all trials, what do you discover? Some trials which really sucked. So, for example, the research performed for analysis leaving out studies at a high risk of bias, meaning I'm doing the trial but I make lots of money off it, and gave less reliable estimates of effect. How unreliable? For example, one of these trials was not blinded, meaning I know who's getting it, who's not. The people that are getting it, I'll count the surviving. The people not, we'll find a way to get rid of them. Was stopped before the planned number of patients had been enrolled, and did not have all those who enrolled counted in the final analysis. This guy was on interferon, he died. Well, obviously, we'll just remove him from the list, so to say. So, they took out those studies. That left to two of the largest trials involving 1,676 patients. Still a very healthy number. Focusing only on these trials, the risk of death was significantly higher on interferon compared to those on placebo or no treatment at all. We're not even talking side effects. So what is the risk? If you were doing interferon, your chance of dying was 9.4%. If you did nothing, your risk of dying was 6.7%. But minus the side effects of the poor people that had to go to the 9.4% that died, and so on and so forth. So outside of some hospital giving you a useless treatment, causing pain and suffering, when you look at the data, it doesn't support, at least the Cochrane Library. And they said, quote, it was troubling to see that in those trials provided the most reliable estimates of treatment, interferon seemed to increase the risk of death, said lead researcher Ronald Quartz of Granada Hills in California. Based on these results, interferon monotherapy cannot be recommended for chronic hepatitis C patients who already failed one course of treatment. And there's something else. When you know what happens when you have hepatitis, they check you what's called sustained viral response. Well, the interferon did lower the sustained viral response. But the researchers at the Cochrane Library discovered this doesn't mean anything. It's a sucky data to support the use of interferon. In their words, however, since the response, let's say interferon, let me back it up. Interferon treatment did not seem to reduce levels of hepatitis C virus in the blood compared to controls. Did seem, resulting in what is considered successful treatment. So just pull this number out of the air and interferon affects it. Yay, it works. However, since this response was not associated with an improvement in the disease or risk of death, the review suggests that sustained viral response, SVR, may be inadequate as an indicator of a successful treatment outcome. Sustained viral response, and you don't realize how much I hear that. Oh, my numbers went down. Did not suggest that a patient who was destined to develop symptoms or death from hepatitis C was cured, at least in this setting. So think about that. Let's make a drug. It will make this arbitrary number, which makes it look like the drug works. But we will not go by the number of people or lives saved or harmed or whatever it is. But this number makes the drug look like it's working, and henceforth we'll just imagine it works. Ironically, in a clinical setting, your chance of dying was 9.4% of interferon for retreatment, in which case you get to suffer all the side effects along with it, compared to 6.7% of those individuals that didn't have to suffer the side effects and did frickin' nothing. Nothing at all. Not even a placebo. Nothing. So, something to think about when they try to push it on you a second time, or someone that you love, or someone you know, or hospitals thinking of budgeting this back into this useless treatment paradigm. I don't know, a little bit of blue light, a little less interferon. There's a few billions here saved, and there and there. And now, something more positive. Silibin. Silibin is derived from milk thistle, but it has a real interesting effect on UVA and UVB light. And this was published in the Phytochemistry and Phytobiology journal. Well, this is what they said. Silibin kills skin cells mutated by UVA radiation and protects normal cells, because it doesn't mess with normal cells. It only affects with carcinogenic cells. Amazing for this natural substance. And protects against damage by UVB radiation, thus protecting against UV-induced skin cancer and photoaging. When you have cells affected by UV radiation, you either want to repair it or kill it, so it cannot go on to cause cancer. Silibin, an extract of milk thistle, does both, which is interesting, because it gets rid of those defective cells by something called reactive oxygen species, which is unusual because you think by generating free radicals that you would damage normal cells too. But for whatever reason, the mutated cells or damaged cells can't protect themselves against ROS, reactive oxygen species, and thenceforth die. And they said this: when you take human cells, skin cells, keratinocytes, and treat them with silibin, nothing happens. So, which, again, it's interesting. Here we have this free radical generator that does not generate free radicals in the presence of normal cells. It's non-toxic, but when you damage these cells with UVA radiation, treatment with silibin kills the cells, thus removing the mutating cells that cause skin cancer and photoaging. Then also, in a second complementary study from the Molecular Carcinogenesis, shows that in the Journal of Molecular Carcinogenesis, shows that instead of beneficially killing cells damaged by UVA radiation, treatment with silibin protects human skin cells from damage by UVB radiation, which makes up 5% of the radiation reaching the Earth. And they also said, quote, "This is not something that came out of the blue. It has been 20 years of work with this compound. We first noticed its effectiveness, the researchers, in treating both skin and solid cancers. And we now have a much more complete picture of the mechanisms to allow this compound to work." Remember, it wasn't long ago that milk thistle was shown to stop lung cancer. Actually, it was probably about a year ago it was shown to stop lung cancer dead in its tracks. Interesting part about it, the knowledge is out there. The substance seems to make the stringent quality as far as scientific validity, meaning it has been tested once, and has been tested twice, and has been tested 3 times, yielding the same results repetitively over and over again with retesting. Not just a random fluke. It should be something which should be encountered in more chemotherapy settings and so on and so forth. It should have been studied more and be making it to the public knowledge more, how would you say, with a little bit more expediency. It hasn't yet. So, in this case, mark my words, look at where the footnoted information came out of, who did the studies, where it was published, and start asking your doctor about this. But I'll tell you one thing for certain. The way milk thistle or silibin protects the skin cells from sun damage overall, and how sometimes light can age the skin, it may not be a bad idea just to take for a cosmetic reason to maintain youthfulness for many years to come. As shallow as it sounds, what the heck? A little bit of anti-cancer and a little bit of less wrinkles here and there on a simple dime a dozen supplement sure beats a lot more of those expensive skin creams. And that is it for this 1st of February 2013 another issue of the Health Research Report. And by next week, I hope to have batteries for this light, so it doesn't look like I'm trying to give the report in the middle of the dark. And thank you once again. Catch you in a bit.